Now, my name's Jorge Luis Hurtado. I'm a medical doctor. I studied abroad. I'm currently rotating amongst different hospitals here in California. Right now, I'm in Riverside. And I really believe this is a very interesting and important topic when it comes for us caregivers or direct medical practitioners, us people who care for other people. We usually are going to be caring for the older population, and I think it's very important as dementia is so prevalent and so common that we know what it is. So let's go ahead and begin. Today, you will learn about some data about the epidemiology, how common uh, dementia is. We're obviously going to talk about what dementia is, the causes of dementia, symptoms and behaviors that patients with dementia develop, and just some general considerations at the end. Now, how often do we get dementia? It's estimated that 6.2 million Americans above the age of 65 are living with Alzheimer's dementia. This was in 2021. And by 2050, it's estimated to reach 13.8 million in this country. That's a very significant percentage of our population. You can see why this is a public health concern. And we'll go ahead. Now, it's obviously an impact not only on the healthcare system, but on the people who care for this population. It obviously places a significant economical burden on the healthcare system. It's not just cost, it's increased hospitalizations and greater demand for long-term care services. These people get sick very often due to their mental incapacity. So it is very important to care for them and to treat them in a very early way or detect it in an early manner. Caregivers of people with dementia, they experience physical, emotional, and financial strain. That's why we need more support for our caregivers and the people who care for the dementia patients. I'm sure that at least one of you guys has treated or cared for a patient with dementia, and this is not an easy task. Now, what is dementia? It's an acquired disorder. Nobody is born with dementia, and it's characterized by a decline in cognition involving one or more cognitive domains. What does a cognitive domain means? This is either learning, memory, the ability to possess language, the executive function, the ability to move, complex attention to understand what's going on, the perceptual motor, being able to interact with what we see around us, be able to know what's going on around us and move our bodies in a according manner. And social cognition, just getting along with other humans. If one or more of these domains is affected, we can actually diagnose a patient with dementia. Now, dementia is not one disease specific. There's just not like normal dementia or regular type of dementia. That does not exist. It's not normal to just age and develop dementia. It is a disease, and it's exclusive to the older adults. Well, it's not exclusive to the older adults. There are several populations like Down syndrome or trisomy 21 patients. These people have increased risk of developing early onset dementia. So we're going to go ahead and talk about the different types of dementia. Now, as we said before, not a specific disease. The most common type of dementia, the most famous one, Alzheimer's disease. This accounts for 60 to 80% of every dementia cases. And the non-Alzheimer's dementia, that's Lewy bodies, frontotemporal dementia, Parkinson's disease, pretty famous one, and vascular dementia. Vascular means refers to the vasculature, to our blood vessels. This we see in patients with stroke. Now, understanding the different types of dementia, let's go ahead and start with that. We already mentioned each one of them. This is pretty much the chemistry behind it or the causes of this. For Alzheimer's and Lewy body dementia, and also frontotemporal dementia, they all have something to do with the deposition of foreign material or proteins in our brain and a subsequent destruction of our brains. The difference in vascular dementia from the rest is this is related to strokes, blood clots, and bunch of stuff like that that damages our brain. Now, how does it present? Alzheimer's disease presents, first of all, uh, wondering, getting lost, repeating questions. It's more like a memory and perception problem at first. Then they start forgetting things that they shouldn't forget, like their family members or how to perform their jobs, even how to drive, or they forget the city that they live in. It's really horrible, and when it's really severe, they can't even communicate anymore. It's not a fun thing to have. Frontotemporal dementia. Frontotemporal refers to our frontal lobe and to our temporal lobes. So there's a degeneration of these parts of the brain due to accumulation of different types of products. Pretty much, kind of, we can say it's a little bit of genetic, and it starts with difficulty planning and organizing, and it jumps into a very particular aspect of their presentation. Our frontal lobes are responsible for like our social skills and our ability to take maybe decisions. So they start losing that. So when you see a person that's just doing weird stuff like going to the street naked and harassing people, and you're just like, grandpa, that's not something that you used to do. That's just not right. Like, what got into you? That could be one of the presentations. It usually does present like that. Of frontotemporal dementia. It's related to behaviors and social behaviors. Lewy body dementia. It's a pretty much cognitive decline, their ability to concentrate, pay attention, just work. They come in with disorganized and illogical ideas, and it progresses to the body, muscle rigidity, loss of coordination, and reduced facial expression. And at the end, it has something really different than the rest, which is the sleep disorders that we see these. Insomnia, excessive daytime sleepiness, visual hallucinations, and vascular dementia. Well, like we said before, patients who have multiple strokes or brain attacks, as somebody calls it, um, they start with dementia after they've had like these strokes throughout their life, and it progresses to forgetting like the past and future events, misplacing really important items, uh, functional problems like just not being able to follow instructions or learning new stuff, and it progresses to hallucinations or delusions. Now, the typical age of diagnosis, the only one who presents young on these guys, it's the frontotemporal dementia. The one we said was kind of genetic. It has something to do with behaviors. The other ones we're going to see in older adults. And Alzheimer's disease, we might see people, young people, like 50, 40-ish, developing it, usually people with Down syndrome. We can maybe keep that in the back of our minds. Now, with Alzheimer's disease, we're going to talk a little bit about that. It's a gradual or progressive deterioration of cognitive functions. Like we said before, five cognitive domains, but in this case, it's related to memory, reasoning, and language skills. Like we said before, it's the most common out there. And it's attributed to the accumulation of protein deposits in the brain. They're called amyloid proteins, and these lead to destruction of our brain. On the left-hand side, you can see a normal brain. On the right-hand side, you can see it's way smaller. That's just a little diagram so we can have an idea of how it looks. Here I have the real thing. This is an MRI a CT scan. On our left side we have a normal brain. You see all of that white stuff in contrast to the gray stuff. The gray stuff can be seen as support material just to keep the brain on hold. The white represents the neurons. On our left hand side, yeah, we might have some of that gray stuff, right? But that gray stuff's just meant to support the brain where it is. The white stuff is actually the neurons, the electrical circuits of our brain. If it's not there, it doesn't work. And dementia has more than one cause, different things included, like we said before, multiple strokes, really common diseases like diabetes and high blood pressure increase your risk. Having high cholesterol has shown that it has some percentage of increased risk in people, and an unhealthy lifestyle, that's pretty much a risk factor for any disease. So if we don't want to develop any of them, we better check ourselves before we wreck ourselves, right? Now, this is just a graphic, so we can see that each one of these maybe diseases or modifiable risk factors has a different percentage when it comes to dementia. It starts with less education. This is defined as not doing high school or finishing high school, then hearing loss, brain injury, some diseases, they all carry an independent risk. And later in life, smoking, depression, not having friends, social isolation, believe it or not doing physical activity, diabetes, and from all of these risk factors, about 40% of them can be modifiable. 40% of them, we can do something about it. We can actually reduce our risk 40% if we treat ourselves right and we put a stop to these bad habits. Now, signs and symptoms of dementia. What does dementia look like and what does it not look like? Now, like we said before, this is just a summary of the 5 cognitive domains. We're going to go ahead and talk about how it presents and how do we see it. Now, most patients are not going to come to you and tell you, son or grandkid, I think I have dementia. I think I'm starting to forget things more often than other people. No, it's usually us as family members or caregivers, the ones who realize something's going wrong. And by the time usually that we notice that something's wrong with our cared ones, it's usually really, really like advanced into the disease when we notice something's wrong. So it's important to notice what's right for a normal adult and what is normal aging and what is dementia. We're going to go ahead and try to differentiate that. Now, what is normal for an older adult and what's not? So, self-reported memory loss has nothing to do with you developing dementia, but somebody else bringing their cared one to the office and letting us know something's going wrong. That's when people have dementia. It correlates directly. So, normal, maybe remembering someone's name, somebody that you just met. I mean, I'm 31 years old and I'm really bad with names. That doesn't mean I have dementia, and so I won't blame my mom if she starts forgetting some of my friends' names or something like that. Or just misplacing objects. I sure know I lose my TV remote all the time. Hopefully I don't have dementia, but we'll see, we'll see. Now, possible signs of dementia, it's getting lost in familiar places and forgetting the function of objects that we previously knew how to do. Like if your mom just forgets how to cook your eggs in the morning, you better get worried, all right? Now, normal age-related changes in thinking that might tell us that everything's all right. It's slower to learn new things. Nothing crazy. Solve some problems. All right, doesn't sound crazy. Changes in attention or concentration. You don't have to. You don't need dementia for that. But what does dementia do look like when thinking? Difficulties with the language they already mastered, with the language they knew how to read, and writing or working with numbers. Working with numbers might be a little weird. I know I'm not good with numbers, but let's just keep that out there. Just not being able to read, communicate, or forget English/Spanish or any language, that's a sign of dementia. And changes in judgment, insight, or reason from previous baseline. It's obvious old people change a lot. Let's just uh, make sure we know our family and we know the regular behaviors and what's normal for them and what's not. So any sudden or really harsh changes in baseline we have to pay attention to. In physical changes, obviously we lose all of it, but what's not normal, not understanding what's going on around us, not understanding what we're seeing, not understanding where we are, and sensory processing, not even knowing you have a cut in your hand and not doing anything about it, not understanding what pain is, balance and coordination. Falling is not a normal sign of aging. Just keep that fact in the back of your minds. Falling is not normal. We always have to take a look at that. And changes in behavior are not a normal part of aging. Yes, older adults might be hard to maybe work with. They're pretty special, they're different, but it's not normal to have mood or personality changes, to socially withdraw, or have difficulty initiating new tasks or changes in normal daily routines. Keep this in the back of your minds, guys. Now, this is just pretty much a recap of all of these not normal things that we can actually take a look or to keep in the back of our minds when thinking about dementia or thinking somebody could have dementia. I've seen a lot of patients who are diagnosed with dementia and they actually don't have it. That's just really sad. I mean, because they're labeling them as sick and like dependent in a lot of ways, and they're actually not. So, and that's from physicians. So we can actually, if we learn a lot from this presentation, you might beat a diagnosis or two out there. Now, dementia onset is insidious. It starts subtly. You don't really see it at first, so it's important to notice the subtle changes in the things that we talked about. Because by the time somebody has stopped driving or they can't manage their finances anymore, they've had dementia for years and we never realized it. So it's important to act as fast as we can and detect them as fast as we can to prevent disease progression. So questions when that we might want to ask ourselves when thinking about somebody with dementia: when did we first notice memory loss or a change in the patterns? And how has the memory loss or symptom progressed since we started noticing it? Now, disease progression, what happens? Early in life, memory lapses. Guess we're getting a few things. Like I tell you guys, it starts insidious. Difficulty with planning and organizing still, but they're really independent in this early stage. In the moderate or middle stage, it's increasing memory loss and confusion, difficulty recognizing family or friends. And this is just the moderate part of the disease, and it must be so hard on the family members just to see their cared one not remember them at all. Changes in behavior and personality and the need for assistance just to live. That's just hard, not being able to see our loved ones be independent anymore. Now, at the late stage and the severe stage, this is where everything starts going away. Memory, cognitive skills, they can't communicate effectively, and they usually need extensive help with daily activities. Physical symptoms such as difficulty swallowing, that's just a lot. Now, frequently asked questions. When should we seek medical attention? All the time. As soon as we suspect it, we should talk about it with someone, and we should seek some medical attention to see if maybe we can be diagnosed. Like I said before, sometimes I don't know this I never mentioned. It's important to look for medical attention. Why? Because sometimes memory loss, confusion, they can be caused by other medical problems. One clear example: patients who have diabetes, they take too much insulin, their blood sugar drops. They look pretty confused. They're in delirium. They're not themselves. That's not dementia. That's just like other medical conditions that look like it. So it's important to bring our patients into a medical facility or seek medical attention so they can be properly diagnosed. And that's pretty much the example I just used. And is there any tests that I should take or to maybe see if I have dementia? Not as a diagnosis. The diagnosis of dementia is made clinically with what we talked about, and the definitive diagnosis is actually a biopsy, but that's just something that's not done. We don't poke people's brains to know if they have the dementia or not. No, it's just clinical. We can diagnose it, but things such as CT scan or an MRI, they can give us clues as to where it's coming from or how far into the disease we are. But as far as like detecting it in an early manner, no imaging tests. And how do we treat it? There is no way to treat it, but there is a way to maybe prevent it and halt the disease progression. But this is pretty much dependent on lifestyle factors like nutrition, exercise, sleep, managing stress, neural stimulation, reading, playing video games has also demonstrated that it works. Just keep that in the back of your minds. Uh, Detox, pretty much not drinking, stuff like that. And supplements are a wide array of supplements out there like vitamin B12, amongst others, that have shown not only to decrease or halt dementia progression, but to actually help in a lot of ways. So, physical activity, healthy diet, social interaction, just being out there, talking to people challenges our brains more than we can think of. Engaging in sometimes challenging situations, just as the jobs you must have, resolving problems, that helps your brain develop. This we already talked about, just how to pretty much decrease the percentage of having dementia. Take this away. Change your lifestyle habits. Try to sleep. If you know you have depression or anxiety, seek help. It takes you a long way. Now, general precautions. People with dementia often fall and hurt themselves. So, to reduce the risk of falls, secure the house like loose rugs or non-skid back and run rugs. Tuck away wires, electrical cords. Have the patient wear sturdy, comfortable shoes, and well, a well-lit place will always help. Now, any questions out there?